Right now, large gatherings are still banned, of course, because of the risk of spreading the coronavirus. Here's a look at the numbers in Canada right now. There are over 36,000 confirmed cases of COVID-19 in Canada. That only reflects those people who have been tested. More than 1,600 people are known to have died from it. More than 900 of those people are in Quebec, the hardest hit province. 62 more deaths were reported there today. Some staff in hospitals in Quebec, including nurses and orderlies, are now being redeployed to long-term care homes. That's where the outbreaks are worst and where help is needed the most. As Mike Armstrong reports, even the military is doing what it can.
This is one of 5 teams of Canadian Armed Forces soldiers deployed Monday to Quebec seniors' residences. It's likely not a task any of them predicted when they joined the military, but that doesn't seem to be a problem.
It is most certainly unusual, but we are ready to adapt and overcome any challenge in our way, and we're mostly proud to be here.
Now, Quebec seniors' residences have been hit hard by COVID-19. They have about 4,000 cases in about 150 facilities. They're also short about 2,000 full-time workers. At this residence, one ward over the weekend was staffed by just 2 auxiliary nurses for 40 people. They were overwhelmed. To fill the gap, the military team of 14 nurses, medical technicians, and medical assistants hit the ground running.
Activities of daily living, we call it. So toileting, feeding, grooming, walking, assistance.
Well, we barely got in and we were already working knees deep in it. We were put to work as fast as they could.
Now, urgent help was needed in Nova Scotia as well. This seniors facility went from 50 COVID-19 cases Friday to 150 now. They also have 40 staff off work and had to call in help from the Provincial Health Authority.
We've had to reach out. We're not able to manage this on our own. We were doing very, very well up until the last couple of days.
We're still in the middle of a battle.
In Ontario, the government says its numbers overall have likely peaked, but that the situation in seniors' residences continues to be a major concern. Mike Armstrong, Global News, Laval, Quebec.
Public health officials in Ontario say the restrictions on people's movements have slowed the spread, and though there were more than 600 new cases confirmed today, that's the biggest single-day increase so far. The pandemic, as Mike mentioned, appears to have peaked several weeks ahead of what was forecast. Jeff Semple explains what that means.
This family-run Toronto clothing store is hanging by a thread.
Surviving this is going to be very difficult.
Closed now for 6 weeks, its owner expects the business won't survive another month under lockdown.
I got to open this business back up. I've got inventory to sell, and I've got rent to pay, and I've got kids to feed.
But he and his fellow Ontarians just received some much-needed good news.
Today, we saw new modeling that shows there's some light at the end of the tunnel.
The Ontario government says the province's COVID-19 outbreak appears to have peaked a month earlier than expected.
We still have far to go, but thanks to our collective efforts, we're in a better position today.
Ontario is now expecting this outbreak will see 20,000 cases of COVID-19. That's a quarter of what the province had predicted just a couple of weeks ago, and is even better than their best case scenario.
Which is obviously encouraging. The cases are not going to skyrocket.
This infectious disease doctor helped to produce the latest models and says one area where they underestimated the outbreak was in long-term care homes.
Sadly, we just didn't acknowledge how vulnerable our vulnerable populations truly were.
But in the wider population, many are now wondering how much longer this lockdown will last.
I've been waiting for hip replacement surgery for almost 15 months. I'm wondering when you will be able to start the surgeries again.
Ontario's hospitals canceled non-emergency surgeries to make room for COVID-19 patients and now find themselves with a surplus of intensive care beds. The challenge, how to expand service, while also bracing for a second wave of cases.
It was relatively simple to stop the system. It's actually much more complex to actually turn it back on again.
Experts expect a slow easing of restrictions to begin in a matter of weeks, and small businesses could be among the first in line. Jeff Semple, Global News, Toronto.
There's so much information surrounding coronavirus out there now. We know you have questions. Email your questions at globalnews.ca. Tune in to Global National or go to globalnews.ca/coronavirus now to find the answers.